Now let me explain you regarding the topic menstrual cycle or known as the ovarian cycle. The reproductive period of a human female extends from puberty to menopause. Puberty means it is the commencement of the menstruation, while the menopause is known as the stoppage of the menstruation. So every female may have a reproductive life of 30 to 35 years, whereas the puberty, the commencement of the menstruations may also varies from one individual to another individuals. Maybe in some female, maybe minimum 10 years, maximum maybe 18 years, and also the menopause also maybe from 45 years to 55 years. During this reproductive period of a female, the ovaries and as well as the female reproductive tract undergoes a series of cyclic changes which are meant to prepare them for fertilizations and then pregnancy and collectively form as a menstrual cycle. So the most peculiar feature of this cycle is periodic vaginal bleeding called as a menstruation, which lasts for about 4 days. So the length of this cycle also varies from one woman to the another, but on an average it is completed in 28 days. uh, in the female, the successive cycles may vary in length by 1 to 2 days, but it will be absent during the pregnancy and may be suppressed during the lactation, and permanently it may stop at the menopause. So this menstrual cycle divided into 4 phases. The first phase is known as the follicular phase. The second phase is known as the ovulatory phase. The third phase is called the luteal or the secretory phase. And last phase is known as the menstrual phase. So in the first follicular phase, also known as the pre-ovulatory phase, it will last for about 10 to 12 days, maybe from minimum from 5 days to 14 days of the menstrual cycle, and it will involve some of the changes like there will be increased secretion of the follicular stimulating hormone from the anterior pituitary, and then there will be some changes in the primary follicle of the ovary. Then even the follicular cell of the Graafian follicle will secrete the estrogen, and then the secretion of this estrogen will bring some of the effect in the follicular phase. The first effect which will be brought by the estrogen is the growth, the maintenance, and normal functioning of the secondary sex organ. Stimulation of all these secondary sex organs will occur, and then the uterine endometrium will become thick, more vascular, more glandular, you can say, and then even it will appear in the shape of cork screw. That means preparing itself for the implantation. Means in the because of the release of the estrogen, the uterine wall will be preparing itself for the implantation during this follicular phase. Then the epithelium of the fallopian tube also will become thicker and densely ciliated in order to conduct the zygote or ovum. And then also it will inhibit the secretion of the follicular stimulating hormone, and then also stimulate the secretion of the luteinizing hormone from the anterior pituitary. And lastly, also will help in the accumulation of the glycogen and fat in the endometrial wall of the female. Then in the next phase, that is in the ovulatory phase, the it will it is we can say it involves the ovulations from the Graafian follicle of the ovary. It occurs in the middle way between the two menstrual cycle, that is on the 15th day of the onset of the menstrual cycle. It is caused by the increasing turgidity and then the contraction of the smooth muscle fiber around the Graafian follicles. The ovum will be received by the fimbria of the fallopian tube. So in this stage, the ovum is viable for only for 2 days. So the ovulations in this stage mainly will be controlled by the increased level of the luteinizing hormone in the blood. So the egg in this stage will be in the secondary oocyte stage, and then the luteinizing hormones will start start the change of the anti-Griffin follicle into the corpus luteum. There is a yellow body in the endometrium wall, and then also it will have the secretion of the progesterone from the corpus luteum. Means not much changes will occur in the endometrium uterine during this ovulatory phase. Next, in the next phase, that is in the luteal or the secondary phases, it will last for around 12 to 14 days and may extend from 16 to 28 days of the menstrual cycle. It will be characterized by some changes, like number first is the yellow body. There is the corpus luteum, which will be formed from the empty Griffin follicle, will increase in size. Then it will lead to the secretion of the progesterone hormone, whose level in the blood will gradually increase, and then it will lead to some changes like the secretion of the decreased secretion of the luteinizing hormone, then the follicular stimulating hormone. So it will lead to the maturation of the follicle and the ovulations. Then it will have the further proliferation of the endometrium, and then also ready for implantations. Then, because due to that, the uterine gland will start secreting the uterine milk for the fetus. And lastly, it will reduce the uterine movement. Then in the last phase, there is the menstrual phase. It may last for around 3 to 5 days and may extend from first to fourth day of the menstrual cycle. So during this phase, if the ovum remain unfertilized, then the corpus luteum will start degenerating, and the level, due to that, the level of the progesterone in the blood also will decline. Then the endometrium tissue also will fold in order to maintain. Then the unfertilized ovum, along with the ruptured uterine epithelium, then blood may be around 50 to 100 milliliter, then mucus. All this will discharge out through the vaginal orifice, which is collectively known as the menstrual flow or the menstruation. Then however, if the fertilization occurs, then blastula will undergo implantation, and then the chorionic placenta will be forming between the fetus and the mother. And the placenta will secrete the one particular hormone called as the HCG, human chorionic gonadotrophin, which will be held in maintaining the corpus luteum and the progesterone secretion. And then with the continuing secretion of the progesterone, pregnancy will be maintained, and then the ovulation will be prevent during the gestation period, that is 40 weeks or 280 days.